Case presentation about the myocardial infarction. After all blood is collected from all over the body by vein, it gathering in main vein called superior vena cava that fill all this blood in the right atrium with deoxygenated blood. Right atrium contract to fill right ventricle with blood via atrioventricular valve called tricuspid valve that make right ventricle also contract to pump blood into pulmonary artery, then blood across the alveoli that make the oxygenation for blood, and then blood will return by pulmonary vein to left atrium. Then it will contract to push this blood via valve called mitral or bicuspid valve to fill the left ventricle. Then this oxygenated blood will go by the systemic artery by aorta to all over the upper and the lower extremities all over the body. In the body, LDL increase in blood that make it easier to accumulate in artery and then make a layer of fat in artery obvious to auscultate. When we auscultate the artery, we hear a prolonged sound, so that it develop to produce atherosclerosis by time, and make the diameter in the vessels less and decrease over time, and that make a suddenly partial or complete obstruction in these vessels. You can see these videos about the pathology of the myocardial infarction in the body. Heart attack. The heart muscles needs to receive a continuous supply of blood that's rich of oxygen and nutrients at all times to function properly. This comes from coronary arteries. A myocardial infarction happens when there is a sudden loss of blood flow to a part of the heart muscles. This is usually caused by a blood clot in one of the coronary arteries. Coronary arteries are vessels which supplies the heart of blood and nutrients. When fat builds up inside the coronary arteries, it causes slight injury to the blood vessels. Some chemicals are releasing to heal these blood vessels injuries, which make the vessels walls thicker. These substances traveling through the blood begin to accumulate and stick around this thrombus in the vessels. Fat and other substances combine together, making something called a plaque or clot over time. This plaque deposit develop a hard fibrous covering. When this cracks or tears, the fat inside is exposed and the platelet come to the area which cause a blood clot to form around the plaque. Here we have a sample for someone who has a history of myocardial infarction. We will show the signs and symptoms and the complaining that he felt. This patient is 52-year-old male and he has overweight with 93 kilograms. He arrived to emergency. He has a chief complaint, difficult breaths and chest pain, which make him shortness of breath, dyspnea and fatigue, with cyanosis face and sweating. The pain was radiated from chest to jaw and left arm and concentrated in posture. He has a sign and symptoms with tachypnea, tachycardia, tachypnic breath with difficult to speak a full words without, take a complete shallow and rapid breath, with no obvious allergy to any type of medications or foods. He has no last oral intake, and he described the pain 8 out of 10 severity pain in the pain scale. Medical history for this patient. The patient was complaining from pain and shortness of breath and fatigue while he making exercise. The doctor has diagnosed this patient with a past medical history of a stable angina when exercise. From he was young, he admitted before to emergency complaining from the same sign and symptoms of chest pain and cyanosis phase, and he was admitted to catheterization surgical procedure. Most type of patients who come with the same sign and symptoms have a habit and routine including increased appetite, which he said that he was obvious increasing eating in home in his routine, which make him increase and being overweight with 93 kilogram. This fat is concentrated in the extremities and in the abdomen. Also the other risk factor that he was a heavy smoker. The pain, as the patient described, have a palliation with supine position and when he make a hard thing or being in a hard exercise. The provocation for this patient when he's sitting position or in a tripod position, the pain decreased. General state for this patient with vital signs. Patient was conscious oriented by 3 with 15 GCS in a glass coma scales with difficult breath and chest pain decrease his mental status, and he checked vital signs by a nurse with 35 breath per minute tachypnea. When assisted, chest rise and recoil, tachycardia with 120 beat per minute when assisted by monitor. The patient was hypertensive with 161 systolic on 89 diastolic, and the autosat was decreased until 85% by pulse oximetry. Patient come with the same sign and symptoms have to do some important laboratory test. VBGs, which contain the RBCs, WBCs, and hemoglobin count. Also the liver function test and kidney function test, which give an indication about the creatinine and the potassium and some important element levels. Also the thyroid glands has a strongly linked between the heart rate and thyroid level in the body, that indicated by the T3 and T4 and the TSH level. The most important laboratory test to be done is the heart enzyme, which include INR, prothrombin time, and the PTT, which indicated by the partial thrombin time. Also the other tests will be assessed the normal and the abnormal cholesterol by the differentiation between the HDL and the LDL level. EBGs also can give you some indication about the blood acidity, the autosat, and the HCO3 and the POC. The most important test to be done is the ECG with 12 lead for every single patient come with chest pain and the same sign and symptoms and over 40 years old. Here we have a chart with ECG with obvious ST elevation in lead V1 and V2, with near distance QRS indicating irregular tachycardia and the Q and pathologic Q waves in V1 and V2 with obvious ST elevation indicated and myocardial infarction which have a place in anterior septal. أغلب المرضى اللي بيكونوا admitted ك MI بيكون بالأغلب الهيستوري الميديكال هيستوري تاعهم بيكون فيه الأسبرين موجود، البيبي أسبرين بيكون بالديلي drugs للبيشنت. also patient بيكون take للدراجز اللي بيعمل coating للستوما من الأسبرين نفسه مثل الأوميبارازول. غير انه الموست patient اللي بيجوا بالام اي بيكون معهم ريسك فاكتور او هيستوري بالاتش تي ان بالهايبرتنشن، فبيكون في ادويه مثل الديوريتكس، اللازكس، الفورسمايد، بيكون دواء مثل الكابوتين بالهيستوري للبيشنت. بالنسبة للدراجز اللي كانت في الانترفنشن، البيشنت في البداية مانجينج للريسبيراتوري عشان يعمل helping للانسبيريشن البيشنت اللي هو بيكون النون بريذر ماسك إذا ماسك اللي هو ايش او الماسك اوف تشويس في هاي الحالة. الدراجز بتكون اللي هي 4 تابلت بيبي اسبرين، بتكون النيتروجليسرين سبلينجوال، وبرضه كمان الهيبارين بيكون اللي هو الموست امبورتنت دراج اوف تشويس في حالة الشيست بين اللي بيكون فيها هاي ثريتنينج للميوكارديال انفراكشن. الهيبارين كدراجز إذا بدنا نسلط على الضوء هو أنتي كوأجولانت بيشتغل في الجسم. الدوز تاعته ديبند على البيشنت ويت، بالأغلب بتكون 5000 يونت، ويعتبر دراجز من البري هوسبيتال. الكونترا انديكيشن بشكل أساسي بتكون البليدنج، بتكون الاتشنج في الكالر. الافكت الأساسية إنه بيعمل decrease للفيسكوسيتي في البلد، فبيعمل prevent للclotting factors من إنها تتكون، فبالتالي بيكون drug of choice وبفيد في حالة chest pain للthreatening للميوكارديال infarction. Each patient come with the same sign and symptoms have to be have assessment from A to Z from head to toe. Here you can see some assessment from head to the neck patient without DKBTLS, without any type of infection that make a threatening of head injury or head fracture, no CSF drainage, no atoria, no rhinorrhea, no battle signs or raccoon eyes. Also patient without GVDs and normal eyes with bubbles can look for 4 quadrant. Also patient have a normal chest without any distension, without any trauma threatening, without any DKBTLS. Auscultation of the chest indicate that S1 and S2 with high sounds than normal. Also the patient have the S3 and S4 sounds when auscultation and increasing rapidly in lub and dub. Patient ECG also have an abnormal indication with ST elevation for MI. Here you can see the differential diagnosis also for the extremities without any DKBTLS with normal pulse and motor and sensation. الدياجنوزز حكينا الناس اللي بيجوا معهم مايوكارديال انفراكشن بيكون في ديفرنشال دياجنوزز إلهم، بيكون في داوت انه معهم مصابين بامراض ثانيه. الدي كي اي اللي هو الديابي هايبرجلايسيميك ديابيتس كيتو اسيدوسز من اشهر الثريتنينج اللي الناس بيكون معهم اي لانه بيمتلك نفس الساين والسيمتومز من حيث التكبنيا، الاريوجولار تاكيكارديا، الاسيدوسز، الفيزيكال ويكنس، الا انه الدي كي اي بتميز بالكسمه والبريثنج كتايب من الصعوبه في التنفس، وبرضه كمان بالنسبه للهيت سنسيشن بيكون في فيفر واضحة على البيشنت. هاي الداوت عملنا لها رول اوت وما شكينا في البيشنت انه معه دي كي اي لانه البيشنت ما معه اصلا هيستوري من ال من الدي ام، والدي كي اي always developed from type 1 diabetes ketoacidosis. غير انه بيكون في sign و symptoms واضحة عشان نحكم نعمل judgment انه هذا البيشنت has a diabetes ketoacidosis. بيكون في polyphagia, polydipsia, polyuria، والبيشنت عندنا normal urination. البيشنت برضو has no sign and symptoms of hyperglycemic state، ما في عنده ارتفاع، كانت اللي هي أغلب القراءات بالهيستوري من النورمال رينج. هي البي جي ال كان عنده 5.94 والتراكمي السكر كان عنده 4.2 with a normal range. So the DKA is ruled out. الأذر doubt بتكون اللي هي محتملة اللي هي urinary tract infection UTI. UTI has the same sign and symptoms of myocardial infarction من حيث البين، من حيث الأسيدوسز، breathing difficult breathing، irregular tachypnea، irregular tachycardia، general weakness. بس ال UTI هي بتسبب من bacterial infection، فبالأغلب بيكون في fever واضحة، في palm sensation، حتى بيكون في vomiting، nausea، بيكون في difficult في urination عند البيشنت، وبيكون في type من البين جاي عند جهة البلفيك، البوستشر للابدومين بتكون هي الفلانك بين هي. فال UTI ruled out لأن البيشنت ما عنده هاي الساين symptoms من الفيفر، نورمال فيفر. البيشنت ما عنده فلانك بين في الابدومين، البين عنده concentrated في الشيست ورادييتد على الجو على الشولدرز. بالإضافة لأنه السي بي سي كاونت اليو تي اي بتكون من انفكشن، والانفكشن بالغالب اللي هي بترفع نسبة الدبليو بي سيز كاستجابة مناعية في الجسم كإميونيتي. فالدبليو بي سيز كاونت كانت في أغلب حتى تفصيل الدبليو بي سيز اللي هي كنيوتروفيلز كانت اللي هي within normal range اللي هي 7.2 من حيث الكاونت، فهي بالنورمال ليفلز. غير البيشنت نورمال يورينيت، والكلر كمان لليورين نفسه مش concentrated انه يكون الكلر thick، لا هو نورمال كلر، فبالتالي اليو تي اي ruled out. Learning points from this case: smoking, HTN and diabetes and overweight can be a risk factor and leading cause for myocardial infarctions. Although the doctor said that eating meat can't be the directed cause because the body increase the LDL, but on the other hand it easily to increase the useful cholesterol HDL. Catheterization procedures by putting a stent can prevent heart attack, but on the other hand it can be a risk factor for other disease or for having the patient a new clot in the future. Cardiac and endocrine and respiratory may be misunderstanding and have a difficult and differential diagnosis because they have the similar sign and symptoms, but each one have a single signs can be distinctive to each one to make the judgment. Young people have a higher risk in MI if they have a history with MI compared with elderly, because the vessels in elderly is tortured and semi-dilated compared to younger age, which make them easily have a clotting factor. Women can be less affected by myocardial infarction comparing to men because their female hormones like progesterone that prevent the cardiac muscles are found in men with lesser amount. Here you can look for some resources which can get benefits from.